Turning now to the fight against COVID-19, cases and hospitalizations are on the rise here in Oregon. And in response, the Oregon Health Authority and many counties are recommending that people once again wear masks when they're indoors. The last time our state saw numbers like this, saw this kind of spike, was back in April. And some counties were on the verge of another shutdown. Fox 12's Bridget Chavez has been digging into the numbers.
The new Delta variant of COVID-19 is spreading rapidly in Oregon.
99.5% of the people who are hospitalized now people who are not vaccinated. And the vast majority of them are because of the Delta variant.
Dr. Bukosi Dubé is a senior health advisor for the Oregon Health Authority and says hospitals are beginning to fill up because of this surge. He says they didn't expect the Delta variant would cause as many problems as it has.
Our case counts in Oregon have gone up to over 1,000 a day. That is as bad as it was at the worst of the pandemic.
The last time cases reached this level was in April, and back then, Governor Kate Brown sounded the alarm of a fourth COVID-19 surge.
Right now, in the race between vaccines and variants, the variants are gaining ground and have the upper hand.
Also during that time, Brown set the threshold of 300 for hospitalizations across the state. If we surpass that number, certain counties would have to tighten COVID-19 restrictions like capacity limits and a ban on indoor dining. But now we're not seeing the governor or OHA make moves like that, despite the similarity in numbers. Right now, 274 Oregonians are hospitalized with COVID-19 and 86 are in the ICU.
Communities can make those decisions themselves based on the rate of infection in the community and in reliance on local public health experts and medical professionals, health professionals in the community.
Ken Stedman, a professor of biology at Portland State University, explains that the difference between then and now is that vaccines are widely available and more than 70% of Oregonians have been vaccinated. But he says these case numbers are still troubling.
That if we saturate our ICUs, then they're not going to be available for other things. It's the whole flatten the curve idea. And so, even if you are vaccinated, but you get in a car wreck and you need to go to the hospital, if it's full with ICU, the ICUs are full with COVID patients, that's not going to help you very much.
Bridget Chavez, Fox 12 Oregon.
And the doctor that Bridget spoke with says many of us don't want to wear masks again, but it's important to get back to those basics to help stop the spread. He says if you have not gotten your shot against the virus, now is the time to do so.